Look at our news bulletin. The Gambia records 4 new deaths, over 100 new cases. Barrow says Mali coup drills mediation progress during the ECOWAS Emergency Summit. These and more coming up on Gambia 24. Stay tuned. Welcome back and thanks for joining us. The Gambian president on Thursday joined West African leaders at a virtual emergency summit which condemned the coup in Mali and calls for the restoration of civil rule. More of that on this report by Ibrahim John.
Gambia's President Adama Barrow has condemned Tuesday's coup in Mali, saying it derails ongoing mediations set in motion by the sub-regional bloc ECOWAS. Mediation efforts by 5 West African presidents ended in July without a deal on how to resolve the West African nation's political crisis. Several months of protests calling for the president to step down were unheeded. On Tuesday, soldiers deposed the government of Ibrahim Boubacar Keita and set up what they call the National Committee for the Salvation of the People, CNSP. The committee is made up of 5 military officers and is led by Colonel Assimi Goita as chairman. Mali has seen growing instability since 2012 as a result of insurgent activities that spread to neighboring Burkina Faso and Niger. President Adama Barrow said the summit needed to act fast and tactfully to diffuse the tension. ECOWAS and the EU are worried that the coup adds to further instability in the region. Nigeria's President Muhammadu Buhari said at Thursday's summit that a politically stable Mali is paramount and crucial to the stability of the sub-region. Despite President Keita winning elections in 2013 and 2018, dissatisfaction among the citizens kept escalating. In his 7 years of leadership, Keita's critics condemned his approach in fighting against religious extremists with links to Al-Qaeda and the Islamic State. There were also alleged corrupt acts being linked to his administration and his political party. Reporting for the news, I am Ibrahim John.
Following news of the transformation of Serekunda General Hospital into a COVID-19 treatment center effective on Monday, iAfrica TV asked the Director of Health Service, Dr. Mustafa Bite, what will happen to patients currently admitted at the hospital. Detail in this report by Khadija Tuseka.
While this is thought to be a slow process, patients who are currently admitted at the Serekunda Hospital in Kanifing will have to be transferred to different hospitals as it becomes a COVID-19 treatment center for next week. This move, according to Dr. Mustafa Bite, the Director of Health Services, is necessitated by the increasing demand for bed space for COVID-19 patients in the country.
So the process is not going to be very fast. There are people looking at it and how it's going to be done. But for sure is that all the patients will be taken care of. So how it's going to be done is there's just a redistribution. So it's like you have a pool of patients and then those who are COVID sick from all other facilities now will come here. And the other facilities that have the other services now will take care of the cases that were supposed to be in Kanifing. So we're going to do it to have a smooth transition as much as possible.
Dr. Bite said there are other facilities with basic equipments. However, there are other COVID-19 patients who need just not treatment but also surgeries. He said this provisional decision of all coronavirus patients to be treated in one facility would help to mitigate its spread.
Definitely. That's why it's not a very easy decision, but that's why we are doing it. Because we think that the COVID-19 cases, they are not only medical. You might have cases that will need surgical interventions and other interventions, and a facility with those type of care will be good. It's not. We have a lot of beds, like the stadium is there, the Nemban will be there, and the first phase is already there. But this case is also so. Now, what we come to realize is that COVID patients can also need surgeries. And COVID doesn't look like it's going anytime soon, as WHO has shown. So it's good that until those ones are ready to take care of them, we can use this main one. And it's just a provisional decision, And now we are looking at the implementation. There are groups looking at how we are going to do it smoothly so that it doesn't impact too much on the. And it's not only done here; it's done in many other countries. Like I've come across some documents they shared with me, which showed how, for example, South Korea did it without any problem.
Dr. BT said the health personnel at the Serekunda Hospital are knowledgeable and familiar with the treatment and handling of COVID-19 cases, and as such, there would not be a problem in executing their duties.
A doctor is already a doctor, is trained on basic things, so it's just to reorient them on certain things, on the guidelines, and the IPC training on how to take care of COVID has been going on. Because Canifin, all other hospitals should always expect, they've been receiving cases that are suspected cases, and you have to take precaution just like you are in a treatment center, otherwise you all get infected. So the necessary training, necessary orientation has been going on. So it's not like you are bringing new people who don't know anything and you have to train. No. So these people are trained in their respective regions. They are all professionals. So you need to do some reorientation for them, do some more guidance, some coaching, that's all. But it's not like you are bringing a journalist to Canifin General Hospital.
The country has recorded a surge in the number of coronavirus cases since its outbreak in March. Many facilities have been used as a treatment center and some were even closed due to cross-contamination. Reporting for iAfrican News, I am Khadija Seka.
From that report by Khadija Seka, now on to the latest COVID-19 update. 4 new COVID-19 related deaths recorded on August 20th brings the total number of deaths from the virus to 81 since the first case was confirmed in the Gambia in March. The country currently has 291 people in quarantine, 1,855 active cases, 201 probable cases, and a crude case fatality ratio of 3.4% rather. The Ministry of Health said the bulk of the active cases are asymptomatic and are self-isolating at home pending the manifestation of symptoms. Well, viewers, with this brings us to the end of Gambia 24. I am Sona Tunkara. Good evening.
man kontaan boy mu nekk boy nga ñim bata mu be taki tubabu du boy nga nakko do mu be do ku boy nga kina ñin kendi moy boy pour ay bungulo ñi boro na bu hani lento am futa ji boy de jibe lu njumala ya fuñe koy babul lola ama me ila bu jibe abadame jara foyte lafta fula ñi man baluwo kalam mu baluwo fo baluwo ko burlo ko fa nan kele boy ñim bu ma jala be ñamende abbe mu baluwo la do ko
ñin kunna soniyata ta www.baluwo.com anin baluwo isela bulloran jorangol be sang anila kudola asatare mambata jorangol membu ko sementol kenyo babarol nil peruol woni nga nyon jamal ta baluwo.com yin jorangol be sang ila dinkira bado adungite batala je anin baluwo ifangole marate la kudola